Yeah.
You're welcome back to the stage here at the Agriland Pavilion at the National Ploughing Championships in Ratheniska. Our live stream brought to you in association with UPMC this year. And I hope you've been enjoying our content, because now we're going to focus on, I suppose, farm safety, well-being and health as well. And I mean, farming is an incredibly physically demanding and a very dangerous occupation as well. And for the next while, we're going to focus on making our farms hopefully safer and better places to be as well. And joining us here on the stage is Pat Griffin. Pat is a Senior Inspector for Farm Safety with the Health and Safety Authority. Beside him is Tom McAvoy from Pieta House. Thanks for joining us, Tom. And David Rowsome. David, you've drawn the short straw on the on the stool, but you're fit and able for it. David is a physiotherapist with UPMC's Sports Medicine Clinic in TUS in Moylish in Limerick. You're all very welcome. Thank you so much for taking the time. Pat, I'm going to start with yourself, because as I mentioned, farming, definitely one of the most dangerous, if not the most dangerous occupation in this country. Unfortunately, 13 fatalities on Irish farms last year. It was the sector with the highest number of work-related fatalities. And unfortunately, on Agriland, we've brought some tragic stories this year again involving fatalities on Irish farms, whether that's involving livestock, machinery, falls from heights. It's an age-old question. How do we make our farms safer? And I mean, is it ever possible to completely eliminate farm deaths?
Well, first of all, thanks for covering the subject, because it is so important. And you're right. Sadly, it is the most dangerous occupation in this country. But things are improving. Last year, we had the lowest number of fatalities in the workplace ever recorded in Ireland. So generally, Ireland is improving in relation to workplace fatalities. So we had 27 deaths last year in all workplaces, but sadly 13 of those were in agriculture. And because agriculture makes up about 5 or 6% of the working population, you can see that agriculture is 7 times more dangerous than any other place you work. It is the most dangerous place to work in the country. But we've been working hard. I'd say over the last 20 years, we've had about 20 fatalities every year. So to drop it to 10 in 2021, and sadly 13 in 2022, that is a vast improvement. We want to drive it as low as we can. I think one of the reasons that we have been able to drive it lower is there's a better education now in ag colleges. There is an openness there from farmers to hear about farm safety. You know, farm safety is seen as a positive thing for farmers, and they are engaging, which is fantastic. You know, things like PTO shafts, while they're still very dangerous and they're still causing injuries, the numbers of fatalities from PTOs have really dropped. And that's because we've done a huge amount of work at the Ploughing Championships, at the Tullamore Show, at different events, focusing on that particular issue because it was killing people. This year at the Ploughing Championships, we're focusing on tractor safety and quad safety, because sadly, vehicles are involved with the vast majority of farm fatalities. And it's about someone operating the tractor just not seeing who's around the
That
gears.
blind spot is a big
blind
issue.
spots. And we're demonstrating blind spots over their stand. And we're also demonstrating the use of quad bikes. And out of the 191 fatalities, 100 of them in the last year, 10 years, are vehicle movements in the yard. So we have to start focusing on that.
And often, unfortunately, Pat, very young people and the elderly as well, and they seem to be the fatalities.
It's predominantly children and the older person that can't move out of the way in time. So I think we focus on the vehicles in farmyards, whatever type of vehicle it is, whether it's a tractor, teleporter, a quad, or a large machine, and get it into the farmer's head that once they're in a quad, once they're in a tractor or a big machine, there's blind spots that just won't see people. So the only way to keep people really safe is when these machines are operating in the yard, you just don't have people there.
Yes.
And if someone wants to come into the yard, they have to stop at a certain point, make visible contact with the operator, they stop the machine and to turn off the machine before they start to talk. If we do that, I think we can drop the fatalities even further than we have. And my target is 0, and we want to get there. And children and older people predominantly getting killed on farms, we need to stop it.
Yeah, and look, behind every fatality, you know, there's a devastated family, and there's no words. I mean, every family, unfortunately, you know, who experiences this horror, it's It's something that never leaves your
it's
house.
Shocking.
No, it doesn't.
I worked with Embrace Farm for about eight years, and I've dealt with farm families that have been devastated. It's absolutely shocking.
Yeah.
They never recover. Yeah. They might learn to live with it, but they never recover. We've dealt with people that have had a fatality 30, 40 years ago, and they're still destroyed.
And it can be still as raw.
So we need to stop it.
And look, Pat, just on the HSA's work, I just want to mention as well, and it's something we covered last year here on Agriland, because it was, I suppose, we'd a year out at that stage, but coming down the track very quickly now is the new requirements around the use of quads and ATVs. What do farmers need to know, and what's the date that they need to take action by?
Yeah, like I'll explain why we've done this. Out of the 100 fatalities with vehicles, 10 of those fatalities are from quad bikes. And when you consider the low number of quad bikes in farming, like there's over 300,000 tractors out there. There's about 20,000 quads. So if you have 10 fatalities from quads, it's the most dangerous machine on the farm. So we brought in regulations. They're quite simple. The farmer now has to have training to operate his quad bike and has to wear a helmet. And that requirement of a training and wearing a helmet is across all sectors. Anywhere a quad bike is used, and you see quad bikes used out in the public road for controlling traffic flow. You see quad bikes used in forestry. We see the inland fisheries using it, DSB use them, other utilities.
Yeah.
Anyone operating a quad bike, it's the same law. Training and wearing a helmet.
Okay.
And hopefully that will stop life-changing injuries and fatalities.
Okay, well look, David, I'm going to bring you in here because, as I said, you're a chartered physiotherapist working with UPMC in the sports medicine clinic down in TUS in Limerick. And I suppose you're here at the Ploughing Championships. UPMC have a stand and farmers can go in and talk about aches and pains. And I've no doubt that you've been kept busy because there's a lot of pulling and dragging and hauling and tearing on farms. So I'm sure that you've been kept busy now at the ploughing.
Absolutely. Yeah, I know we really enjoy coming in and listening to people's stories. I suppose, as you said, we're UPMC, the University of Pittsburgh Medical Centre, are trying to build a big presence here in Ireland, so they offer quite a lot of services across the country. So we've a number of hospitals around. We've the UPMC Sports Surgery Clinic, they've recently acquired up in Dublin, down in Oddhaven in Kilkenny, Whitfield and Waterford, and in Kildare. And then I suppose myself, I'm a physiotherapist in the sports medicine clinic down in Limerick, and we have a number of sports medicine clinics around the country as well. So I suppose we see quite a few patients. We see people from every walk of life. So we've definitely encountered a few people from the farming population as well, because as you said, it's a very tough, very intense job, and we all know those intense calving or lambing seasons. That I suppose you're struggling with sleep, struggling with stress, quite a high workload, and it just doesn't, I suppose, help. It doesn't help pain at all, if you know what I mean. So, so we see everyone, and we're just trying to, I suppose, build our presence here in the farming community and just make people aware of just the services we offer across the country. So,
and I understand for maybe something like physiotherapy, it's something that you can refer yourself into and approach UPMC directly on something like that if you have a niggle. Absolutely,
yeah. So we have a self-referral service in all our clinics and a GP referral service as well. So yeah, so we're really trying to get our brand out there just to make people aware, and it's quick access. So we have quite a few services then we offer in our clinics, like osteoarthritis classes for people with long-standing hip or knee arthritis, and then we've exercise classes for long-term disease. So it's brilliant. We've seen quite great results from the classes so far as well.
Yeah.
So
and I'd say, David, a lot of it as well is preventative as well. We want to try and prevent the injuries happening and try and offset disease occurring if we can at all, and keep ourselves as healthy as possible. So any tips and advice for us all?
I actually had this conversation recently with a sheep farmer from down in Waterford, but I suppose one thing I always try to say to people is, we all understand that these lambing seasons, these calving seasons, they're going to be stressful no matter what. So I suppose one thing I'd always try push with farmers would be to get fit for spring, so that those downtime periods, that you're really looking after yourself. You're getting anything that's maybe lingering, maybe getting some professional advice on it, getting it looked at, and working on certain things, be it your range of motion, your shoulder, your strength in your knees and your hips. But really taking those downtime periods to, get your body as prepared as possible. I use the analogy of, you didn't quite like this, but the GA pre-season. So not everyone's favorite time of the year, but it's, but there's definitely, I think there's a lot we can take from that. We can look at just, let's say, the farming or the lambing season, the calving season as a big body of work, and you're just preparing your body for that. So all these little things I find quite helpful. So it's been more.
And I know you have quite an involvement with sports teams, so the pre-GA season reference is something you're well used to that as well, David. And look, I suppose the classes as well, as you said, there's something as well that it kind of breaks down the barrier. We were speaking with Clodagh from UPMC as well. Often it can be very intimidating for somebody. They're putting off maybe dealing with whatever's bothering them because, I don't really want to go to a physio or to a doctor or a consultant. So, breaking down those barriers, being at something like the National Ploughing Championships, it brings you out of the clinical setting and amongst the people.
Absolutely. It makes us more personable, more approachable. I suppose all we want to do is help people. So that's, I suppose, what we're trying to push.
And do you think the class settings help that as well, break down, people who are dealing with maybe similar issues, and they can speak to their peers about that then?
100%. Yeah, there's a massive social aspect to it. And just seeing, that there is people that are going through something maybe similar to you. So I think that's been a massive plus in the classes as well. Yeah.
Okay, Tom, I'm going to bring you in here as well because, look, the area of well-being is something that is incredibly important as well. And Pieta House, you're at the coalface, I suppose, when people feel that they really need help, that they feel that maybe life has gotten a little bit too tough and that they might need a bit of support. Can you tell us a little bit about the work that Pieta House do? You're also here on site, I should say, for the National Ploughing Championships.
Thanks, Aisling, for having us here today, and hello to everybody at Agriland. Yes, we were kindly invited to join the IFA stand today and be part of an initiative, a collaborative initiative, to bring awareness of our work to people coming through the stand. And absolutely, nobody can be removed from, stress. And I was interested to hear David advising how to perhaps, work with your physical health, and that matches up with your emotional health and your mental health, obviously. So, we're really trying in Pieta to create an awareness around suicide prevention in our work. And I suppose, there's a common theme that, people who die by suicide, perhaps, they might not have been able to be helped. So, fortunately, in our work, we have seen hundreds or thousands and thousands of people come through our doors who have been helped in a physical way to have a presence with a therapist and receive completely free therapy from us. And, they've gone on to continue to live very well lives as a result of that help. And that, I suppose, what we're trying to do here is, talk to people and not make it ordinary that, you can share a load or share a burden with somebody who you might not know. But it helps to be aware that the stigma around talking about your mental health has reduced over the years, we're glad to say, and that continues to help people reaching out and looking for that support.
Because farming can be quite isolated at times,
yes.
and I think, joining up with the likes of the IFA is a way to reach that audience.
We've heard lots of stories coming through, thankfully, people sharing with us of living in isolation, first of all, and also working in isolation. Maybe not speaking to somebody from one end of the day to the other.
Yeah.
And, there was a time when the postman used to come along, or the post lady used to come along, and they'd share a story with them. The same with sharing a story with somebody on the other end of the bar stool or the bar.
Yeah.
Now, a lot of that doesn't happen because of circumstances. And
I remember speaking to a farmer some time back, and he said that he loved to see the postman coming, and he loved junk mail, because we were discussing about junk mail at the time and doing away with junk mail for the environment. And he said, I love junk mail because it means that the postman calls.
I know.
And I have somebody to talk to, and it was just that
and really
interaction.
what works, whatever works for you, to create, a connection. And maybe somebody is shy and they don't want to reach out. So we often say it's incumbent upon us as a community to reach out to people, to, maybe see people who do live in isolation and are a little bit shy, or create that ambience that they're okay or they don't need that support. And, it's incumbent upon us as a society really to be there for our those people who might find it hard to reach out. And, our free phone helpline is really an important connection for all communities, no matter who they are. We are dealing with people from the age of 8 to people in their 80s. This year alone, our therapies being delivered to under 18s, 38% of our client base is under 18 at the moment, which is a huge increase on previous years on a certain cohort. And we're seeing a lot of older people also coming to us, which is fantastic. Like when people hear of statistics, they say, geez, that's a lot or whatever. But we're looking at it in the other way, in that perhaps, there's a greater awareness and there's an easier access to help.
Yeah.
Definitely in the community, people don't realise the volume of help that's out there.
Yeah.
It's only when maybe a tragedy hits their door or in their community, they then realise, there's lots of help out there, but we didn't realise it, that. But we can continue to promote, but it's up to people to also reach out and ask for help.
And take that step.
And not to be stigmatised about that.
Yeah.
Because, it definitely has got better over the years. And we're doing a lot more talking, which I think is helping. Suicide has come down over the last number of years as well, which is really helpful to know, because there's a lot of organisations doing great work, and it's good to see that is impacting.
Okay, and Pat, I know the HSA also has done work in this area, and looking at the whole area of farmer well-being as well.
Yeah, we in our Farm Safety Action Plan, which is spread over 4 or 5 years, and what we need to do for farmers' safety and health, we actually have a health committee. It's called the Health and Vulnerable Persons Working Group, actually. And over the last couple of years, we've actually produced a booklet on farmers' health and well-being, and we've tried to cover all the aspects of health, from stress and pressures to physical safety, their diet, cardiovascular health.
And where can farmers get that?
We've actually posted it to every single farmhouse.
Fantastic.
In January. So every farmhouse has got that booklet, and we've more down at our stand.
Okay.
So we are focusing on health and the holistic approach about health.
Yes.
And just to mention to you, Tom, we also produced a video on suicidality, and it was a gentleman called George Graham, a lovely, lovely man, who has spoken openly about his suicidal thoughts and how he reached out.
Yes.
And he got help, and it really pulled him back, and he's a survivor.
Okay.
And he does great work. He set up an organisation called Head to Toe.
Yeah.
And he talks to farmers all over the country.
And Pat, can people see that on your social channels?
Yeah. That video is on the HSA
Excellent.
website. Yeah.
And David, I might just bring you in here. I know obviously you're a physiotherapist, but somebody's mindset when they're coming to maybe an injury or surgery or post-surgery or anything like that, it's all holistic, it's all part of the approach as well, and it's something I'm sure you're very conscious of in UPMC as well.
100%. Yeah, no, the patient's always at the centre of everything. So, yeah, it's a massive decision. A person, let's say, going down the surgical route, it's a massive decision in someone's life. It's going to affect quite a few things. It's going to affect how much you can do on the farm. It's going to affect how much you can do at home. So it's a massive decision. So I suppose just personally, like working in clinic, I always try to work with the patient. Our job as a physio is to optimize someone's function and try and help them, I suppose, function as best they can without impacting their quality of life too much, you know.
And stopping working, because I think that's always a fear as well, yeah. I know you're big fans of movement instead, and I probably should ask you as well, David, some tips for us all to get our cars out of the car park safely and ergonomically, because I think we might need it today.
Spread the load, plenty of numbers.
We might all have, we'd have to mind the back, pushing the car into the car park this morning and out this evening, but it's all part of it, and look, there's a great atmosphere today, and it's drying up as well. David, obviously, farmers can pop into the UPMC stand. They can obviously look up the website as well if they want to see your suite of services. And Tom, I suppose from Pieta's point of view, do you want to give the free phone number if somebody wants to reach out?
Thanks for that. People can contact us any time of the night or day, 24/7, 365 days of the year on 1800 247 247. It's a free phone helpline. There is a therapist on the other end of that phone who will be able to help you and perhaps be a solution-focused conversation rather than just a listening service. So there is particular method in the way we approach that. We also offer great help on our pieta.ie website. We have lots of insights and lots of information there, and we'd encourage people to, connect with us whenever they wish to even find out more information about the service, not necessarily for them, but perhaps for a loved one.
Yeah, and look, I suppose finally, Pat, as well, the HSA website, always a wealth of information, maybe doing a risk assessment on your farm, as you were pointing to earlier, or looking up the video of George, and there's a wealth of information always on the HSA website.
If anyone has time to visit our HSA stand here, please do, and our HSA website has huge amounts of information and an index of all the videos that we've done. There's loads and loads of information there.
Fantastic. Well, David Rowsome, a physiotherapist with UPMC, who are sponsoring our live stream here at the Ploughing. We're very grateful to them. Tom McAvoy from Pieta House doing great work as well. And of course, Pat Griffin from the Health and Safety Authority. Thank you all so much for joining us. A really important discussion, I think, and hopefully our viewers got a lot out of that, and everybody here in the pavilion at the National Ploughing Championships. And we're going back out onto site now to see what else is going on in Ratheniska today.